right, folks, this will be the last chat in the introductory material before I start getting into the meat of this course around anatomy and physiology of swallowing. This chat is intended to introduce you to the necessary coordination between the respiratory and digestive systems in order to achieve safe swallowing. So it's meant as a high-level overview before we get into the nuts and bolts of swallowing, so that you're aware of the overarching element of the very first of the three focuses of the SLP in swallowing, which is to ensure safety of transport of food from the oral cavity down into the stomach or the lower GI system. Okay, so that safe transport is going to require coordination between the respiratory and digestive systems. As we go along in our chats over the next weeks, we're going to talk more about this, but I wanted to give you a high-level review so that you hold this very close in thought as we go along. We're going to see that there is significant overlap in the anatomical structures that we use for breathing and for swallowing. And so we're going to need to coordinate these two systems in order to achieve swallowing in a safe manner. I'm going to encourage you to pull out your notes and your class materials from SLP 320, Anatomy and Physiology of the Speech and Hearing Mechanism. Even though you may not have covered swallowing, anatomy, or physiology, or only covered it very minimally, because there's overlap in the anatomical structures, it may benefit you to go back and just review the structures to familiarize yourself with the content before we move forward. If not, don't worry, I'm going to continue to review the anatomy with you. So, because I'm probably going to be introducing you to some new terms. Okay, let's move forward. Now, you may remember from your anatomy and physiology class that the word pharynx means your throat. Okay, so your pharynx is your throat, and there's three subdivisions of the pharynx. Let me get my pen out here so I can show you. There's three subdivisions of the pharynx. Okay, so the throat is back here. And you may remember from your A&P course that we have the nasopharynx, we have the oropharynx, and then we have the hypopharynx. Okay, so down at the bottom is hypo, in the middle is oropharynx, and then at the top is nasopharynx. And we'll review it again as we go forward. But the pharynx, the layman's term for that, the common term that people use, is the throat. And we can see, let me erase for a second, folks, so that you can see what I'm doing here. Hold on. Okay, you can see here on the slide that this is one tube up here. Okay, so the pharynx at this point is, sorry, let me go back and grab the pen. The pharynx at this point is one tube. We can see it right here as one tube. Okay. As we move down in the pharynx beyond the oropharynx, the pharynx is going to bifurcate. That means it's going to split into two. So think about the word bicycle. Bicycle means two cycles or two wheels. Bifurcate means that it's going to split into two. Okay. The front tract is known as the respiratory tract. So that anterior tract is the respiratory tract. And the posterior tract is our digestive tract. Now look at the spelling of that. It's not track with a K, it's tract with a T. Okay, so the front is our airway. That's our windpipe. This is where we're going to get gas exchange between oxygen and carbon dioxide. Okay, so that's over here. This is our respiratory tract. In medical terms, the respiratory tract is called patent, and that word means open. So at rest, the respiratory tract is open. It's patent so that we can breathe. So we need it to be open so that we can do that because we're constantly in cycles of inhalation and exhalation. The posterior tract, on the other hand, which is our digestive tract, we can see is closed. Look at it back here. It's collapsed. Okay, so the stomach tube or the nourishment tube is closed at rest. Now, we don't want air getting down there because we would get a bloated chest, right? So, if you're talking a lot while you're eating, for example, you're having dinner out with people and you're doing a lot of talking, you might be swallowing some air with your food and you may have to belch, for example. Okay, so you might have to burp and get that air back out. This tube is closed, right? And so we don't want air in that tube. Air needs to come to the front part of the tube. So back here is our stomach tube or our digestive, if you will, our digestive tract. Okay, so let me remove the writing again and just make sure that you can see it here, that you can see that the airway is open. Look at it. Here it is, wide open. Whereas the stomach tube is collapsed. You can see it totally closed. Okay, so those are things to keep in mind as we move forward because under normal circumstances, under just as you're sitting there listening to this chat, unless you're swallowing or unless you're holding your breath, your airway remains open or patent so that you can be in constant cycles of respiration. The only time we're going to close that respiratory tract is when we hold our breath or we're trying to evacuate something by coughing or getting something out, or if we're swallowing. Okay, so let's move on. The respiratory tract, which is in the anterior aspect, is going to go from our nasal and oral cavities, right? So we can breathe either through our nose or through our mouth. And normally, if we're exercising very heavy, we'll shift from nasal breathing to oral breathing or a combination of nasal and oral breathing, right? So most individuals are nasal breathers. Some people do breathe through their oral cavity on regular circumstances, but most of us are nasal breathers. When we have to increase our oxygenation, we generally shift both nasal and oral cavities, moving down into, so let me draw it just so that you can see it, folks. So we've got our nasal cavity up here, we've got our oral cavity down here, and then we're moving into our pharynx. That's over here. Okay, so that's that back part. Our respiratory system is then going to move into the larynx. That's the middle region of our respiratory tract. So let me use blue on here so you know that this is the larynx. Okay, and then we're going to move into the lower respiratory system, which includes the trachea right here, our bronchi, the right and the left. Remember, this is the person's opposite, and then our lungs. Okay, so there's our respiratory system. We have the upper respiratory system, which is nasal, oral, and pharyngeal. We have the mid region, which is the larynx, and then moving down to the inferior respiratory system, the trachea, bronchi, and lungs. Okay, so this pharynx, the pharyngeal cavity, the pharynx is the throat that's going to bifurcate. In the front, it's going to move down into the larynx, trachea, bronchi, and lungs. Now, I want to introduce you to some terminology around respiration, which you may have learned in your anatomy and physiology class. You may not have. So let's introduce it here because we do talk about this terminology when we work in the domain of swallowing. So the first thing to know is that breathing, technically the act of breathing or moving air into and out of the lungs is known as pulmonary ventilation. So the technical or medical term for your lungs is pulmonary. Whenever you hear that word, you know that a physician or medical staff are talking about lungs. And ventilation means the exchange of gases within the lungs. So pulmonary ventilation means moving air in and out of the lungs. Now, we do that with a respiratory rate, and this you may be more familiar with. In a medical chart, it will be capitalized as, it will be abbreviated as two capital R's. That means respiratory rate. And our respiratory rate is the total number of breaths per respiratory cycle that occur in a minute. Okay, so, and that breaths in a respiratory cycle means inhalation and exhalation. So the total number of those that occur in a 60-second time frame. And we know that the vast majority of adults, at least in the United States, and please know that this is different depending on disease state, age, pliability of the lungs, but also pollution in the air. So in some countries or some cities where there's higher pollution, people have to breathe more frequently. But it's typically known that the normative data in the United States is that we have about 12 to 15 cycles, meaning inhalation plus exhalation per minute or per 60 seconds. Okay, and what that means if you do the math, so if we convert a minute into 60 seconds, that means that we're generally completing one cycle of respiration, an inhalation plus an exhalation, about every 4 to 5 seconds. Okay, so 15 cycles per 60 seconds would be 4, and 12 cycles per 60 seconds would be 5. So we're completing one inhalation and exhalation cycle about every 4 to 5 seconds. And one of the things that we know under normal circumstances is that we spend about 40% of our time inhaling and about 60% of our time exhaling. This should be familiar if you go back and review your notes from SLP 320. Okay, so about 40% of this 4 to 5 seconds is spent inhaling, and about 60% of that time is spent exhaling. That means we're inhaling for about 1.5 to 2 seconds, and we're exhaling for about 2.5 to 3 seconds. Okay, so that is an important element when we're trying to coordinate our swallow around our constant breathing, which we're going to talk about here as we move on in the class. Okay, moving into the digestive tract. Again, that's the posterior tract. That's the one in the back. Okay, and that's going to move from the oral cavity, right? That's not the nasal cavity. Okay, so unlike respiration, we're not using our nasal cavity for digestive purposes. If something's getting in the nose, that's aberrant. We shouldn't have material in our nasal cavity. So we're going to use our oral cavity. And again, we're going to move the food to our pharynx. Okay, our pharynx is going to bifurcate. Now look in this picture. I think this is a good picture of, you can see that the larynx over here has been moved up and out. They removed the trachea, they removed the bronchi, and they removed the lungs. So we can see this is the front of the person's face, and we can see that the larynx or the respiratory system is in the front. It's the anterior tract, whereas the digestive tract is in the back of this person's body. So we're going to use our oral cavity moving down into our pharynx and then down into our stomach tube or our esophagus. Okay, so the pharynx is going to be continuous down with our esophagus. That's going to go down into our stomach. And then from our stomach, it goes into the small. So you could see this going into the peach color. It goes into our small intestine and then into our large intestine. Now, for purposes of this class, I'm not going to ask you to memorize these terms, but I do want to introduce you to them because if you move on in our field in swallowing, these are terms that you will hear in our field. So the small intestine in particular is made up of structures known as the duodenum, the jejunum, and the ileum. Those are important elements when we are looking at feeding tubes for patients who are not safe to eat by mouth. They may have tubes in those areas. and then moving down into the large intestine, which is mainly made up of the colon, the cecum, and the rectum. Okay. And it is important for us as speech language pathologists to understand a little bit about this system, because if for any reason the patient has had surgery or they have an impaction and they can't move material out of their body below, it's going to back up above. And that means that it's going to threaten the airway. And you'll remember, once again, one of the driving questions that the SLP is going to ask themselves is, can the patient safely swallow? Are they going to be able to safely take food by mouth? So if we have a backup of this system where the food is coming back up, the patient may not be safe. So those are things that we're going to consider as we consider our swallowing. Okay, let's get into some terminology around the digestive processes. The term ingestion means taking food into the mouth. In layman's terms, we might call that eating, but ingestion really means intake. Okay, so taking it in. Propulsion means moving it on. Okay, so that generally includes both the aspect of swallowing in the upper digestive system and then propelling it down through the esophagus. Okay, so that's moving the food through the alimentary tract or the nourishment tract. So we're going to ingest it by taking it into our mouth, and then we're going to propel it through the tract. We're then going to do, and we're going to do some mechanical breakdown. I don't want to say then, because we do some mechanical breakdown before we propel it too. So we're going to do some mechanical breakdown. We're going to break down the food as we're chewing it. So that's mastication. We need to break it down when it's in the oral cavity. But then the stomach is going to further break it down mechanically so that we can then use it for fuel. The term digestion means breaking down those food molecules into their chemical components. So, for example, our stomach has digestive enzymes that are going to help us. So, I said digestive enzymes, right? So, the stomach has digestive enzymes that are going to break down the food that we took in, that we ingested, into its chemical components so that the body can use the chemicals. The body is going to use the chemicals by absorbing them. So the cells are going to uptake that digested material into the blood or the lymph system so that the body can use those chemicals as fuel. And finally, there are indigestible substances that we consume that need to be excreted through the body. That's called defecation, right? So that is having a bowel movement, for example. We need to get rid of the material that the body is unable to digest. Okay, so we have some overlapping anatomy that you should be familiar with already from your anatomy and physiology class. There is a neurophysiological, meaning that not only are there structures that have overlap, but we also have neurological control of these structures that is overlap. So we have both structural and functional interdependence between the anatomy of respiration and swallowing, right? So when we're taking material into our mouth or we're taking air in, we need the lips, we need the face, we need the tongue. We're going to have the palate involved and the pharynx. And from there, you're going to see I have there in italics and a pink box, the larynx. The larynx is associated with respiration. We do not want food going down there. So when we're swallowing, we want the larynx closed. We don't want any material getting into our respiratory tract. But for purposes of swallowing, we want to move the material from the pharynx down into the esophagus. Okay, likewise, we don't want air in our esophagus. We don't want air in our stomach tube. That will create bloating. And as I'm sure you're familiar, if you get air in your esophagus or in your GI system in general, it's either going to come out through your oral cavity, that would be a belch, or it's going to come out through your colon and your rectum, and you know what that is. Okay, so in order for us to move from respiration to swallowing, we need to switch. And this has to be done with a very intricate balance. Okay, we have to safely engage in task specific functions. We don't want to be ingesting air, and we don't want to be breathing in food particles, okay, liquid or food particles. So we need to coordinate these things. And that coordination is going to require the integrity of sensory motor mechanisms. At this point, you should remember also your notes from SLP 491, the neural correlates of communication. So I'm also going to encourage you, strongly encourage you, to pull out the notes from your neuro class to understand how the brain does sensory motor functions. What that means is we need to have structures within the respiratory and swallowing system, right? And remember, we're talking about overlapping anatomy that sense when material is coming, and that are going to motorically trigger which of these pathways we need to have open to satisfy the function that we're engaged in. Okay, so that's the first thing. We need to have adequate integrity of sensory motor mechanisms. And when those mechanisms are faulty, we can have problems coordinating our breathing and our swallowing. It's going to require contraction of muscles across the system. So the first piece is integrity of sensory motor mechanisms. That's like, does the brain sense, and can the brain control these mechanisms? We also have to have muscles that are strong enough to do this, right? So the muscles need to contract. They need to have good range of motion. They need to have good strength in order for them to adequately perform the functions that we're trying to engage in. Another thing about the coordination of breathing and swallowing is that there's going to be generation of pressures to contain the bolus and to move it through the system while protecting the airway. So there's got to be pressure behind the back of the bolus to move it down and get it through into the stomach tube. Okay, so we need to be able to coordinate that and generate sufficient pressures to move things. And then finally, we're going to need rapid coordinated timing between closing our airway and having bolus propulsion and clearance, right? Very intricate timing, because remember, I just covered with you that we're completing a respiratory cycle every 4 to 5 seconds. That means we're inhaling after about 2.5 to 3 seconds of exhaling, right? So I'm only going to be inhaling about 1.5 to 2 seconds while I'm exhaling 2.5 to 3 seconds. So I have a very short window before the body needs to inhale again. Okay, I've got about 2.5 to 3 seconds where I'm typically exhaling before I need to inhale again. So remember, when the body is in need of oxygen, we're going to inhale. So that requires extreme coordination between our inhalation and our exhalation, or our arrest of inhaling, in order to safely swallow and get things through into the esophagus. So some key elements of that coordination. Respiration is a continuous rhythmical behavior, while swallowing is induced by food, liquid, and or saliva. So you may not be familiar with this right now. It's generally not in our conscious thought, but we're constantly swallowing our saliva. You may think that you're only swallowing when you're drinking or you're eating food, but you're constantly reflexively swallowing all day long your saliva. Why? Let me go back, because if you have integrity of your neurological system, integrity of sensory motor mechanisms, meaning you feel your saliva building up and your muscles are adequate, you're going to sense that saliva and you're going to need to get rid of it. So unless you're walking around spitting all the time, the only way to get rid of that saliva is to reflexively swallow. And we're doing that all day long, but for the most part, we're breathing. So the important thing to recognize is that we're constantly in respiratory phase, right? That's an involuntary system unless we consciously take it under voluntary control. We're breathing reflexively all day, in and out, cycles over and over and over again. So we must arrest or inhibit or interrupt the respiratory cycle in order to engage in swallowing. We have to stop the respiratory cycle so that we can swallow. Now, that arrest of the respiratory cycle is known as swallow apnea. So, apnea means a cessation or an arrest or inhibition or stopping of. Okay, that's the medical term for stopping to do something. So, we need to arrest our respiration in order to engage in swallowing. This is an important concept that I want you to write down and make sure that you refer to as you're studying. That in most human beings, and that means infants and adults alike, the arrest happens during the expiratory phase of the respiratory cycle. So we'll begin our exhalation and then we go into apnea, meaning as we are exhaling, we arrest the exhalation, swallow, and then finish exhalation. Now, this should be intuitive if you think about it, because if anything has gone the wrong way, let's say material went down into the airway accidentally, we want to continue through with our exhalation so that we can propel anything that went the wrong way back up and out of the airway. So it's safer to swallow while arresting an exhalation than to swallow during an inspiratory flow. Because if we're doing it during inspiration, we could very easily inhale material into our airway. So folks, let's come back once again to the timing of this cycle. If you think about the fact, let's go back for a second and just make sure that we remember exhalation takes about 2.5 to 3 seconds. So if we are arresting the exhalation somewhere in this 3 seconds, we're going to start the exhalation, we're going to arrest the exhalation, we're going to swallow, and then we're going to continue with the exhalation. Because we need oxygen, we're very rapidly going to inhale again. So we need to open that airway back up so that we can get oxygen back in. Now, many people can hold their breath for much longer than that. But when we're thinking about people who have swallowing disorders, and most of them, many of them are related to poor sensory motor functions, poor neurological control, or neurological injuries, it's going to become very difficult for those individuals to hold their breath or to manage the coordination between these things. So there's a very intricate balance between coordinating this exhalation with the swallow and continuing forward with the exhalation before we inhale again. And if anything is in the way that didn't get down when we swallowed, it can very easily wind up in the airway, because remember, we share the pharynx. The pharynx is shared between the breathing system and the digestive system. So coordination of respiration and swallowing takes very intricate control of these muscles and sensory motor functions. It can be influenced by a number of things, including the properties of the bolus itself. So coordination of breathing and swallowing is heavily dependent on how large of a bolus I have and what is the viscosity. That means the thickness of the bolus, right? So if it's thin like water, that's very different than swallowing something like a piece of steak. It is also highly dependent on the swallowing task. Am I drinking sequentially? Like I'm very thirsty and I'm drinking a large volume of liquid all at once. It depends on whether or not I'm chewing, for example. That's mastication. If I'm chewing and chewing, I might still be breathing, right, while I'm doing that, or any other kind of compensatory behaviors. And those are generally used when patients have swallowing problems. So if the person is doing something to manipulate their swallowing, that can impact their coordination between their respiration and swallowing. And then other things like personal factors, age, gender, health. For those that are elderly and those that are in poor health, they may have a more difficult time coordinating respiration and swallowing. We'll know that biological males in general, on average, remember folks, these are generalizations and statistical norms, but biological males normatively have larger lungs, larger respiratory systems, which means that they may be more capable of holding their breath for longer periods of time to coordinate this. Okay, so when we think about bigger systems, we think about greater capacity. So this is certainly simple enough to coordinate for healthy young individuals, right? As long as people have healthy respiratory systems, healthy neurological function, this can be very easy to coordinate. Most of us can carry on full-length conversations while we're eating at the dinner table. But should someone have um, anything in relationship to respiratory compromise, they're short of breath, they're in respiratory failure, they have chronic obstructive pulmonary disease, they have neurological deficits. That means deficits in sensation or deficits in motor control or muscular function. Any of those things can result in significant coordination problems between our breathing and our swallowing. I'm going to ask you to write down any questions that you have and bring them to live chat.